During this Bladder Cancer Awareness Month, one of the things that I want to talk about are some of the unmet needs of bladder cancer patients. One challenging area that isn't talked about a lot in the bladder cancer space is the need for development of core muscles and pelvic floor muscles to control your bladder. During the time I was being diagnosed, up until after my treatments had begun, I experienced a lot of issues with bladder control, to the point where at work I started to change my wardrobe and wear untucked shirts to protect myself from the embarrassment of wetting myself at work. And after my partial cystectomy surgery, where part of my bladder was removed, I actually underestimated the recovery that was going to be necessary to rebuild my core muscles, which had to be cut through to reach the bladder to remove the section that had the cancer growing in it. I eventually ended up in physical therapy to rebuild my pelvic floor and my core muscles. Now, those of you that follow me know that I'm a podcast nerd, and so I do listen to a podcast called the Urology Care Podcast. And they recently did a series called the Pelvic Power Series, where they talk to doctors and patients about pelvic floor and the need to develop it and help to control your bladder. Now, the women's experience with bladder cancer and with bladder issues in general is very different from the men's experience. And so I really was interested to hear from a patient named Sandra, being interviewed here by Dr. Una Lee and by a physical therapist named Stephanie Pendergrast on the podcast. Here, Sandra brings to light a concern that she has with the way that women's urinary and bladder issues are portrayed in the media and in marketing, and expresses how this is something that she will not accept. Take a listen.
If I go out for a walk and I have to go home because all of a sudden I feel like, for whatever reason, I have no bladder control, that's not acceptable to me as a lifestyle. I do keep fit. I do take care of myself, mental health, physical health, and self-care. And I thought, why would I want to live that way? I'll say something else that I find disheartening at best. I see commercials now with 8 different kinds of beautifully advertised young women depends. I'm like, no, this is not normal. We never had this. So I feel for the community of people who have, the women who have this, who are thinking it's normal because, oh, look, we've now normalized urinary tract incontinence. And no, someone else can accept it in their life. I'm just not going to.